Hello, Zoltan here from Adagio Hands, releasing stuck bodies. Have you ever wondered, is massage a massage a massage? Is it just about the music that's been played in the background? This video looks at the types of things that a massage will address, more specifically soft tissue therapy will address. We'll start with a bit of history, then we'll look at examples of what we can do, and then perhaps look at some self-massage. So the history, of course, we know massage has been around for thousands of years with the Chinese, the Egyptians, the Greeks, the Romans, of course. Then it fell out of favour a bit in Europe over the ensuing centuries, and then we hit upon the Enlightenment. So in the Enlightenment, we discovered medicine, and then later on we discovered antibiotics and surgical procedures, and manual therapies weren't considered as sophisticated. So back in the days, massage was almost a go-to therapy for a whole range of ailments. It was a touch therapy that could help resolve all kinds of problems. But then with modern science and with modern medicine, we became more specific and more analytical, but dare I say more reductionist in how we approached problems. Come maybe the end of the 20th century, we've started to look more deeply at those holistic methods, and they're making a comeback in the 21st century when we're realizing the limitations of more reductionist medicines and medical techniques, which is not to say that they don't have their place, of course. I mean, huge advances in science. And just think about people who might obviously need some manual therapy. So think about sports people, the sprinter Usain Bolt, the boxer Tyson Fury, the tennis player Roger Federer, the athlete Jessica Ennis-Hill. So I'm just putting out there some big names, some all-time greats in the sports world who have massages on a very regular basis. But other performers as well, whether it's dancers or musicians or acrobats, will also benefit hugely from manual therapies. It'll be perhaps less obvious. They won't necessarily be public about the injuries and the pains, aches and pains that they suffer in a way that perhaps some athletes and team sports players may be. So what kinds of things can soft tissue therapy or massage address? And by the way, I throw in soft tissue therapy because massage can often sound like, oh, it's a nice back rub, which is wonderful. With soft tissue therapy, we've realized that there's a bit more to it. We're addressing the whole range of soft tissues, so not just the muscles, but the tendons, the ligaments, the connective tissue of the body. And it's a therapy, so we're clinically assessing, treating, and rehabilitating minor and chronic musculoskeletal conditions. So that's where the term soft tissue therapy comes from under the wider term, the umbrella term of massage. So it may be that we just want a nice relaxing session, maybe some deep tissue going deep into our body. But equally, we may want, before a performance, whether it's a musical performance or a sports event, we may want something that isn't so deep. We don't want it to affect our bodies deeply, but we may want it just to ensure that everything is tracking smoothly and that everything is nicely released for the big event. We may have other goals. We may have an injury that needs rehabilitation that may involve opening up the injury a little first, allowing it to heal properly, and then allowing the scar tissue to be laid down in a way that's aligned with other muscle fibers. We may just want to build our range of movement, flexibility in a certain area. So that's going to be a very different approach that perhaps employs some neuromuscular techniques to release the nervous system. So there's a whole range, and not forgetting, of course, pain in the body, whether it's a specific pain in one spot or more general pain. And how do we address that with some touch therapy, validating that pain and then helping it to dissipate. And by the way, I have a little prop here for some of the work that I do. So I work a lot with whole body connectivity and bringing the body into a greater sense of ease. So if you look here, do you see this is a rubber stick essentially, and do you see that it's bent and there's some torsion in there? So do you see there's some tension? Imagine that that's somewhere in your body. Maybe your shoulder, maybe your hip, maybe your back, or maybe it could be just the feeling your whole body is in. And is there a way, perhaps through soft tissue therapy, of bringing that into a greater sense of ease, relieving that bend, relieving that torsion, and allowing that tension to dissipate? It doesn't mean everything must be perfectly straight and perfectly symmetrical. It just means taking out the tension that's there in the body so that we can go about doing the things we love to do with greater ease. Now, it's worth, therefore, thinking about your objectives when you go and see a manual therapist. And I hope I've given you some thoughts as to what your objectives, your more specific objectives, might be. And let's just finish with looking at what we can do for ourselves. I'll just put this down here. So think of a spot that you feel could usefully be touched. And I'll just give some examples for office workers. Very often, just from staring at the computer screen, it will be in the back of the neck, maybe back of the shoulders. But for someone else, it may be the wrist, whether it's office worker or perhaps musicians. People who lift things, might be the lower back. You might see people with their hands on their lower backs. You might have pain in the hip. It might be the hamstrings that feel tight. So as a first approach to self-massage, just touch the area. See how that feels. Give it a gentle rub. Imagine a child who's fallen over and they have some injury. You might rub the area and see if that feels nice. It might be the back of the neck. Wherever it is, just give it a little rub and see if that feels nice. And if it does, you can keep doing that for yourself periodically. You can also push your fingers in a bit more, maybe hook them in so you're not having to exert too much muscular pressure. Just allow gravity to push in. Because what you don't want is your whole body to tense up in an attempt to relax another part of the body. And this is the bane of our lives as soft tissue therapists, is we can't always reach our own bodies in the way that we can help others. But look, this feels quite good to me. So you can have a go at just touching, rubbing, and then gently pushing into an area and see if that feels good. If it feels good, if it feels healthy, if it feels like good pain. Is there such a thing as good pain? Yes, there is, and you'll feel it. If it feels like good pain, then keep doing it and see if that offers you some relief. If you find you just can't get to the spot, or you're having to really exert force and that you're just going to cause yourself other problems, then that's the time that you might consider going to see a massage therapist, a soft tissue therapist, manual therapist. I hope you found that helpful. Thank you for listening. I look forward to seeing you in another video.